Good morning, my name's Dr. Jeremy McAnulty from New South Wales Health, and I'm here to give you an update on the COVID numbers for the 12th of October 2021. There were 360 locally acquired cases of COVID reported in New South Wales in the 24 hours to 8 o'clock last night. There were 88,988 COVID tests reported in the same period. In terms of vaccination, the total number of vaccines administered in New South Wales is now more than 11 million. To 11:59 p.m. on Sunday, the 10th of October, across New South Wales, 90.4% of people 16 years and over had received first dose of COVID vaccine, and 74% were fully vaccinated. In terms of hospitalisations, there are currently 766 people with COVID admitted in New South Wales hospitals, including 155 in intensive care, 74 of whom require ventilation. Of the 155 people in intensive care, 109 are not vaccinated, 34 have received one dose of vaccine, and 12 have received 2 doses of vaccine. Sadly, New South Wales Health is reporting the deaths of 5 people with COVID, 4 men and 1 woman. 1 person was in their 40s, 1 in their 50s, and 3 people were in their 80s. 3 people were from Nepean Blue Mountains, 1 was from Western Sydney, and 1 was from southeastern Sydney. 3 people were not vaccinated and 2 had received 2 doses of COVID vaccine. A man in his 80s who died at Campbelltown Hospital was a resident of the Hawkesbury Living Aged Care Facility in Richmond, where he acquired the infection. He had received 2 doses of COVID vaccine and had underlying health conditions. A woman in her 80s who died at Hawkesbury Living Aged Care Facility in Richmond, where she had acquired the infection. She had received 2 doses of COVID vaccine and had underlying health conditions. We'd like to extend our sympathies and condolences to the families and loved ones of these people who have died. There have now been 444 COVID-related deaths in New South Wales since the 16th of June and 500 since the beginning of the pandemic last year. In terms of suburbs and localities with the highest numbers of cases in the last 24 hours to 8 o'clock last night, there's Oran Park, Greenacre, Albion Park, Villawood, Ingleburn, Blair Athol on the Central Coast, Wyoming, Woodbury and Weston near Newcastle, and Cooma in southern New South Wales. New South Wales' ongoing sewage surveillance system has detected fragments of the virus that cause sewage in places without recent cases, including Brooklyn in northern Sydney and Gerringong and the south coast. All of us across the state, but particularly in these areas, please come forward for testing immediately if you get any of the symptoms of COVID, even if they're mild. Don't wait to see if they go away. And as we open up in New South Wales, it's important that we all maintain those COVID-safe behaviours. Isolate until you get a negative test. If you have any symptoms at all, don't go out, don't go to work, don't go on public transport until you get a negative test. Please maintain social distancing so that you assume anybody you're near might have COVID. Keep your distance. Wear a mask where you need to under the public health advice. And importantly, let's all get vaccinated. Remind our family and friends, if they're not yet vaccinated, if they're eligible, to come forward for vaccination. The more people get vaccinated, the safer we'll be as a community. Thanks very much.